Top 30 Caregiver Interview Questions and Answers. Are you preparing for a caregiver job interview? In this video, we'll walk you through the top 30 caregiver interview questions and answers to help you impress employers and land your dream role. Whether you're an experienced caregiver or just starting out, you'll learn how to showcase your compassion, skills, and professionalism. From common behavioral questions to situational scenarios, we've got you covered. Watch until the end to gain confidence and stand out in your next interview. 1. How do you deal with a nonverbal client? Dealing with a nonverbal client requires patience and creative communication strategies. I focus on understanding their needs through observation of body language, facial expressions, and any sounds they might make. Utilizing tools like picture boards or communication devices can greatly enhance our interaction. Establishing a routine helps them feel secure, making it easier for them to express their feelings or needs. I also engage in active listening, ensuring that I provide a calm and supportive environment. Building trust is essential, and I take time to connect with them in ways that matter, respecting their unique preferences and personality. 2. What would you do if you notice signs of abuse or neglect? If I notice signs of abuse or neglect, my first priority would be the safety and well-being of the client. I would document the signs meticulously, noting dates, times, and specific observations. Following this, I would report my concerns to the appropriate authorities, such as a supervisor or a social worker, ensuring that the situation is assessed by professionals trained to handle such cases. It's critical to approach this matter sensitively and discreetly, respecting the client's dignity while ensuring they receive the protection they need. Additionally, I would offer support to the client, ensuring they feel safe and heard throughout the process. 3. How do you react to a client who tries to wander or leave the house? When a client attempts to wander or leave the house, my first priority is their safety. I would calmly approach the client, using a gentle tone to engage them and understand their intentions. It's important to assess if they are confused or seeking something outside. I would redirect their attention to a safer activity, like a favorite hobby or conversation. If they seem restless, I could suggest a short walk within a secure area to satisfy their need for movement. Additionally, I ensure that the environment is safe by securing doors and using alarms if necessary. Building a trusting relationship helps in minimizing these situations, as clients are more likely to communicate their feelings and needs. 4. Have you ever had to deal with a medical crisis alone? Dealing with a medical crisis alone can be daunting, but also an opportunity to showcase quick thinking and problem-solving skills. In a previous situation, I found myself responsible for a client who suddenly collapsed due to a heart issue. I immediately assessed the situation, checked for responsiveness, and called emergency services while performing CPR until help arrived. Staying calm was crucial, as it allowed me to focus on the client's needs. Afterward, I documented the incident meticulously and communicated with the family about what occurred. This experience taught me the importance of preparedness and the necessity of remaining composed under pressure. 5. How do you keep a client with dementia calm? Keeping a client with dementia calm involves several strategies tailored to their specific needs. I prioritize creating a familiar and safe environment, reducing noise and distractions that may cause anxiety. Engaging them in simple, meaningful activities helps maintain focus and reduces agitation. I use gentle, reassuring communication, often incorporating their personal history or interests to evoke positive memories. Consistency is key. Maintaining a routine helps clients feel secure. Additionally, I observe nonverbal cues, adjusting my approach based on their responses. Patience and empathy are essential, allowing me to connect with them on a deeper level during challenging moments. 6. What would you do if your client falls? If my client falls, my first priority is to ensure their safety. I would assess the situation to determine if they are injured and check for any immediate medical needs. If they're in pain or unable to move, I would avoid moving them and call for emergency assistance. If they're conscious and able to communicate, I would reassure them while waiting for help. Once the situation is stabilized, I would document the incident thoroughly, noting the circumstances and actions taken. It's crucial to inform the family and relevant healthcare professionals about the fall to prevent future occurrences and address any potential safety issues in the home. 7. How do you manage time when the client has many needs? Managing time effectively when a client has multiple needs involves prioritizing tasks based on urgency and importance. I start by assessing the client's immediate requirements, such as medication schedules, meals, and personal care. Creating a structured daily plan helps ensure that all needs are addressed within the available time. I also communicate with the client to understand their preferences and adjust the schedule as necessary. Delegating tasks, when possible, can help alleviate time constraints. Flexibility is key. If unexpected situations arise, I adapt my plan while maintaining focus on the most critical aspects of the client's care. 8. What's the most challenging case you've handled? One of the most challenging cases I managed involved a client with severe dementia who exhibited aggressive behavior. This client was often confused and frustrated, leading to outbursts that were difficult to manage. I approached the situation with patience and empathy, utilizing techniques such as redirection and distraction to help calm them down. I also collaborated closely with the family and healthcare team to ensure consistent communication and care strategies. This experience taught me the importance of flexibility, adapting my approach based on the client's changing needs. It was rewarding to see gradual improvements in their behavior over time. 9. How do you respond if a client accuses you of something you didn't do? When a client accuses me of something I didn't do, I remain calm and composed. My first step is to listen carefully to their concerns without interrupting, validating their feelings while ensuring they feel heard. I ask open-ended questions to clarify the situation and gather more details. It's important to maintain a professional demeanor and avoid becoming defensive. I document the conversation accurately, noting any specifics related to the accusation. If appropriate, I involve a supervisor or relevant family member to mediate the situation. Transparency and honesty are key, as they help build trust and resolve misunderstandings effectively. 10. Tell me about a time you improved a client's quality of life. One memorable experience was when I worked with a client who had limited mobility and felt isolated in their home. I initiated a weekly routine of engaging activities, including gentle exercises, reading sessions, and even virtual family video calls. This not only helped improve their physical condition but also lifted their spirits. I noticed they began to look forward to these sessions, and their mood improved significantly. By facilitating social interactions and promoting physical activity, I was able to enhance their overall well-being and create a more positive atmosphere in their daily life. The joy on their face during our time together was incredibly rewarding. 11. What's your approach to end-of-life care? End-of-life care requires sensitivity and respect for the individual's wishes. I prioritize open communication with both the client and their family to understand their goals and preferences. My approach focuses on providing comfort, dignity, and emotional support during this challenging time. I ensure that pain management is effectively addressed and that the client feels safe and cared for. I also facilitate discussions about advanced directives and help families navigate the emotional aspects of this journey. By being present and attentive, I aim to create a peaceful environment that honors the client's life and legacy. 12. How do you handle differences in values, culture, or religion? I approach differences in values, culture, or religion with respect and open-mindedness. First, I strive to understand the client's background and beliefs by actively listening and asking respectful questions. This helps me gain insight into their perspectives. I am adaptable in my caregiving approach, ensuring that I provide care that aligns with their values and preferences. When necessary, I seek guidance from family members or cultural liaisons to better understand specific needs. Communication is key. I maintain an open dialogue, allowing clients to express their concerns and preferences. Building trust through empathy and understanding is essential in creating a supportive environment. 13. What would you do if a client's health suddenly declines? In the event of a client's sudden health decline, my first step would be to assess the situation quickly and calmly. I would check vital signs, look for any immediate distress signals, and ensure the client's safety. If the situation appears critical, I would call for emergency medical assistance while providing any necessary first aid. I would inform the client's family or designated contact promptly. After the emergency is under control, I would document the incident and communicate with healthcare professionals to ensure continuity of care. Regular follow-up with the family and healthcare team would be essential to address any ongoing concerns and to adjust the care plan as needed. 14. How do you manage clients who are depressed or emotionally withdrawn? Managing clients who are depressed or emotionally withdrawn requires a compassionate, patient approach. Establishing trust is essential. I take the time to listen actively and validate their feelings. Engaging them in conversation about their interests or memories can help break the ice and encourage participation. I also create a routine that includes enjoyable activities, promoting a sense of normalcy and structure. Collaborating with mental health professionals is crucial, as they can provide guidance on therapeutic strategies. Additionally, I monitor changes in their mood and communicate effectively with family members to ensure a support system is in place. 15. How do you respond when you feel overwhelmed? When I feel overwhelmed, I first take a moment to pause and assess the situation. I practice deep breathing techniques to calm myself and regain focus. Prioritizing tasks becomes essential, so I list what needs immediate attention and what can wait. If possible, I delegate some responsibilities to team members, which helps reduce the burden. I also make sure to communicate my feelings to a supervisor or colleague, seeking support when necessary. Taking short breaks throughout the day allows me to recharge. Lastly, I reflect on my coping strategies and adjust my approach to ensure I manage stress effectively in the future. 16. How do you handle clients who have hallucinations or paranoia? When working with clients experiencing hallucinations or paranoia, I prioritize creating a calm and safe environment. I approach them with empathy, actively listening to their concerns without judgment. It's crucial to validate their feelings while gently redirecting them to reality when appropriate. I maintain a reassuring presence, using a soft tone and maintaining eye contact to build trust. If necessary, I consult with healthcare professionals for guidance on medication adjustments or therapeutic interventions. Continuous observation is vital, ensuring any escalation is addressed promptly, while documenting incidents for future reference. It's essential to support the client's dignity and autonomy throughout the process. 17. What's your plan if your client becomes unresponsive? If my client becomes unresponsive, my immediate plan would be to assess their condition. I would check for responsiveness by gently shaking them and calling their name. If there is no response, I would check for breathing and pulse. If the client is not breathing or has no pulse, I would call emergency services right away while starting CPR if trained. If they are breathing but still unresponsive, I would place them in the recovery position to keep the airway clear and monitor their condition until help arrives. I would also notify family members or designated contacts, document the incident, and follow up with healthcare professionals for further care. 18. How do you handle a situation where a client is in pain but won't take meds? When a client is in pain but refuses medication, I first prioritize understanding their concerns. I would calmly ask them why they are hesitant to take the medication, listening closely to their feelings or fears. It's essential to validate their emotions while providing reassurance about the medication's benefits. I would also explore alternative pain relief methods, such as relaxation techniques, hot/cold therapy, or repositioning. If the situation persists, I would communicate with the healthcare team to discuss further options and ensure the client receives the necessary care while respecting their wishes. 19. How do you set boundaries with clients or their families? Setting boundaries with clients and their families is crucial in maintaining a professional caregiving relationship. First, I clearly communicate my role and responsibilities from the beginning, ensuring that expectations are understood. I also establish open lines of communication, encouraging families to voice their needs while gently reinforcing my limits. When boundaries are tested, I address the situation promptly, using empathy to explain the importance of these limits for the well-being of both the client and myself. Regular check-ins can help keep everyone aligned and respectful of the boundaries set, fostering a positive environment for care. 20. Describe a time you had to advocate for your client. In one instance, I was caring for a client who was experiencing significant pain but struggled to communicate effectively with their healthcare providers. I noticed that their pain management regimen was inadequate, as they often appeared uncomfortable and agitated. After discussing my observations with the family, I took the initiative to arrange a meeting with the healthcare team. During the meeting, I presented detailed notes about the client's condition and the impact of their pain on daily activities. As a result, the medical team adjusted their pain medication and developed a more comprehensive care plan that addressed the client's needs, ultimately improving their quality of life significantly. 21. How do you handle miscommunication with healthcare professionals? Miscommunication with healthcare professionals can be challenging, but I prioritize clear and open communication. First, I ensure that I actively listen to instructions and confirm my understanding by paraphrasing the information back to the professional. If I notice any discrepancies or unclear points, I don't hesitate to ask questions for clarification. I maintain detailed notes to keep track of important information, which can help bridge any gaps during transitions of care. Building positive relationships with healthcare professionals is important, so I approach each interaction with respect and professionalism, fostering a collaborative environment that encourages effective communication. 22. What do you enjoy most about caregiving? What I enjoy most about caregiving is the opportunity to make a meaningful difference in someone's life. Building genuine connections with clients gives me a sense of purpose. I find joy in helping them maintain their dignity and independence while supporting them through challenges. Witnessing their smiles, sharing stories, and celebrating small victories create a rewarding experience. Every day brings unique interactions and the chance to learn from clients' life experiences. Helping families feel at ease knowing their loved ones are cared for is fulfilling. Each moment spent in service, whether it's a simple conversation or assisting with daily tasks, enriches my life and reinforces my passion for this profession. 23. What's your greatest strength as a caregiver? As a caregiver, my greatest strength lies in my ability to connect with clients on a personal level. I prioritize building trust and rapport, allowing clients to feel comfortable and safe in my care. This connection enables me to understand their unique needs and preferences, which is crucial for providing tailored support. I am also highly adaptable, capable of adjusting my approach based on the specific circumstances and challenges each client presents. My strong communication skills help bridge the gap between clients, their families, and healthcare professionals, ensuring that everyone is on the same page regarding care plans and expectations. This collaborative approach enhances the quality of care I provide. 24. What's your biggest weakness in this role? One challenge I face as a caregiver is my tendency to become overly emotionally invested in my clients' well-being. While this passion drives me to provide exceptional care, it can occasionally lead to feelings of frustration or sadness when clients experience setbacks or health declines. To address this, I actively practice self-care and mindfulness techniques to maintain emotional balance. I regularly seek support from colleagues and participate in professional development workshops focused on resilience and coping strategies. This approach helps me stay focused on providing high-quality care while managing my emotional responses effectively. 25. How do you handle stress and burnout? Handling stress and burnout involves proactive self-care and effective coping strategies. I prioritize regular breaks during my shifts to recharge and practice mindfulness techniques, such as deep breathing and meditation, which help manage anxiety. Maintaining a healthy work-life balance is essential, so I ensure to engage in hobbies and physical activities outside of work. I also seek support from colleagues and talk openly about challenges. Regularly reflecting on my experiences allows me to identify stressors and address them promptly. By focusing on positive interactions with clients, I create a more fulfilling caregiving experience, reducing the risk of burnout. 26. How would others describe your caregiving style? My caregiving style is often described as compassionate and attentive. I prioritize building strong relationships with my clients, ensuring they feel respected and valued. Colleagues have noted my patience, especially when dealing with challenging situations, and my ability to remain calm under pressure. I often take the time to listen to my clients, understanding their needs and preferences, which helps foster trust and comfort. I strive to be adaptable, tailoring my approach to fit individual client requirements. Ultimately, I aim to create a positive and supportive environment that enhances the quality of life for those I care for. 27. Are you more task-oriented or relationship-oriented? Being relationship-oriented is crucial in caregiving as it fosters trust and emotional connection. Building a rapport with clients helps me understand their needs and preferences better. This approach allows me to provide care that is not only effective but also compassionate. I prioritize communication and actively listen to my clients, ensuring they feel valued and respected. However, I also recognize the importance of being task-oriented when necessary. Completing tasks efficiently is essential for maintaining a structured environment and meeting health requirements. Balancing both aspects enables me to deliver holistic and personalized care. 28. How do you show empathy and compassion in your work? Empathy and compassion are integral to my caregiving approach. I actively listen to my clients, ensuring they feel heard and understood. By maintaining eye contact and using a warm tone, I convey my genuine concern for their feelings. I strive to put myself in their shoes, recognizing the challenges they face. Simple gestures like holding their hand or offering a reassuring smile go a long way in making them feel valued. I also take the time to learn about their preferences, likes, and dislikes, which helps me tailor my care. This personalized approach fosters a trusting relationship, allowing clients to feel safe and respected in my care. 29. What motivates you to continue caregiving? Being a caregiver is profoundly rewarding. The ability to make a meaningful difference in someone's life drives me daily. Witnessing clients regain their independence or find comfort during difficult times is incredibly fulfilling. Building relationships with clients and their families fosters a sense of trust and connection that motivates me to provide the best care possible. Additionally, the opportunity to learn and grow in this field keeps me engaged. Each client presents unique challenges and experiences. Knowing that my support can enhance someone's quality of life reinforces my commitment to this vocation. It's about compassion, dedication, and the joy of helping others. 30. How do you build trust with your clients? Building trust with clients involves consistent communication, active listening, and demonstrating reliability. I prioritize establishing a rapport by learning about their preferences, interests, and needs. I ensure that I respect their privacy and confidentiality, which helps create a safe environment for them. Being transparent about my actions and decisions also plays a significant role in fostering trust. I follow through on commitments and keep them informed about their care plan, which reassures them of my dedication. Engaging with clients empathetically and validating their feelings helps deepen our connection, making them feel valued and understood. Thanks for watching our guide on the top 30 caregiver interview questions and answers. I hope these tips help you feel more confident and ready to shine in your next interview. If you found this video useful, please give it a like, share it with others preparing for caregiver roles, and subscribe for more career advice. Remember, caregiving is about heart as much as skill, so let your compassion show. Best of luck on your journey, and you've got this.